Medicare now covers weight loss drugs for the first time in 2026 through a groundbreaking pilot program that could save eligible seniors over $800 per month on medications like Ozempic and Wegovy. This historic shift ends Medicare's long-standing ban on obesity treatment coverage and represents one of the most significant changes to senior healthcare benefits in decades. For years, millions of Medicare beneficiaries watched as these revolutionary weight loss medications transformed lives while remaining financially out of reach. With monthly costs exceeding $1,000 without insurance, seniors faced an impossible choice between their health and their financial security. That all changes in January 2026, when a carefully negotiated deal between the Trump administration and pharmaceutical giants Novo Nordisk and Eli Lilly makes these life-changing medications available to qualified Medicare beneficiaries for just $50 per month. But here's what most seniors don't realize yet: this isn't universal coverage. Only about 10% of Medicare beneficiaries will qualify for this pilot program, and the eligibility requirements are surprisingly specific. Understanding these requirements could be the difference between paying $50 per month or continuing to pay over $1,000 out of pocket. Let's start with the medications themselves, because the names can be confusing. We're talking about a class of drugs called GLP-1 medications, originally developed to treat type 2 diabetes but later discovered to be remarkably effective for weight loss. The main players are Ozempic and Wegovy from Novo Nordisk, and Mounjaro and Zepbound from Eli Lilly. Here's where it gets interesting. Ozempic and Mounjaro were the diabetes drugs that doctors noticed helped patients lose weight. Wegovy and Zepbound are essentially the same medications, just repackaged and marketed specifically for weight management. These aren't your typical diet pills. GLP-1 drugs work by mimicking a hormone your body naturally produces when you eat. They slow down how quickly food leaves your stomach, help regulate blood sugar, and most importantly, they reduce appetite by affecting the hunger centers in your brain. Clinical trials have shown average weight loss of 15 to 20% of body weight over the course of a year. For a 200-pound person, that's 30 to 40 pounds of sustained weight loss. The financial breakthrough that made Medicare coverage possible happened on November 6, 2025, when President Trump announced direct negotiations with both pharmaceutical manufacturers. This wasn't just another government price control measure. Instead, it was a head-to-head negotiation that resulted in prices dropping from approximately $1,000 to $1,350 per month down to just $245 for Medicare. That's roughly 1/9 of the original list price. For Medicare beneficiaries, this means a monthly copay of just $50. Compare that to the previous reality where seniors were paying $900 to $1,300 per month out of pocket, and you begin to understand the magnitude of this change. The government's cost went from potentially unsustainable to manageable, while seniors saw their costs drop by over 95%. The story of how we got here is just as important as where we're going. The Biden administration actually proposed covering these medications for Medicare beneficiaries in November 2024. The proposal looked promising until budget analysts ran the numbers. The 10-year cost estimate came back at $25 billion, with extended projections reaching $60 billion through 2034. In April 2025, just 5 months after the initial proposal, the Centers for Medicare and Medicaid Services officially decided against coverage, citing unsustainable budget impact. This decision left millions of seniors in limbo. Many had been following the news about potential coverage, adjusting their healthcare budgets and discussing options with their doctors. When coverage was rejected, the disappointment was widespread. Senior advocacy groups called it a betrayal of Medicare's promise to provide essential health care, while fiscal conservatives argued that Medicare couldn't afford to become a weight loss program. The Trump administration's approach was fundamentally different. Rather than accepting the pharmaceutical companies' list prices and trying to make the math work within existing Medicare budgets, they went directly to Novo Nordisk and Eli Lilly with a different proposition. The details of these negotiations haven't been fully disclosed, but the results speak for themselves. By achieving an 80% price reduction from list prices, the previously impossible became not just possible, but financially prudent. Now let's talk about who actually qualifies for this coverage, because this is where many seniors will discover whether this news applies to them personally. The pilot program covers approximately 10% of Medicare beneficiaries, and the eligibility criteria are quite specific. The primary pathway to coverage is severe obesity, defined as a body mass index greater than 35. For a person who is 5 feet 6 inches tall, this means weighing more than 217 pounds. For someone 5 feet 10 inches tall, it's 245 pounds. If you meet this threshold, you likely qualify for coverage regardless of other health conditions. The second pathway is for those who are overweight but not severely obese, with a BMI greater than 27, but only if you also have specific additional health conditions. These include prediabetes, established cardiovascular disease, advanced kidney disease, heart failure, or uncontrolled hypertension. This is important because it means being 30 or 40 pounds overweight might qualify you for coverage, but only if you have one of these serious health conditions. There are also specific condition-based qualifications. If you have obstructive sleep apnea along with obesity, you qualify. If you have cardiovascular disease plus being overweight or obese, you qualify. These aren't arbitrary requirements. They reflect medical evidence showing that weight loss medications provide the greatest health benefits for people with these particular combinations of conditions. What's fascinating about these eligibility requirements is how they align with clinical evidence about who benefits most from these medications. This isn't just about cosmetic weight loss. For someone with severe obesity, losing 15 to 20% of their body weight can mean the difference between needing knee replacement surgery or not, between developing type 2 diabetes or avoiding it entirely, between taking multiple blood pressure medications or being able to manage hypertension with diet and exercise. The timing of this coverage is also strategically important. The pilot program launches in January 2026, which coincides with a parallel initiative called TrumpRx.gov. This program extends access to uninsured and underinsured Americans who don't qualify for Medicare but also can't afford these medications at full price. Under TrumpRx.gov, the same medications will be available for $350 per month initially, trending down to $245 per month as the program scales up. This dual approach addresses a criticism that Medicare coverage alone would create an unfair two-tier system where seniors get affordable access while working-age Americans remain priced out. By launching both programs simultaneously, the administration creates a pathway for broader access while using Medicare as the anchor program that makes the entire initiative financially viable. Let's walk through what this means in practical terms for someone who qualifies. Imagine you're 68 years old, have Medicare Part D coverage, and meet the eligibility requirements. Starting in January 2026, you could visit your doctor, get a prescription for Wegovy, and pay just $50 per month at the pharmacy. The same medication that would have cost you $1,350 per month in 2025 becomes affordable on a fixed income. But there are still steps in the process. Your doctor will need to document that you meet the eligibility requirements, which might involve calculating your BMI and reviewing your medical history for qualifying conditions. Your pharmacy will need to verify coverage through Medicare Part D, which might involve prior authorization depending on your specific plan. And you'll need to commit to long-term treatment, because these medications work best when used consistently over time. The medication selection process is also worth understanding. While Ozempic, Wegovy, Mounjaro, and Zepbound are all covered, they're not interchangeable. Your doctor will consider factors like your other medications, kidney function, history of pancreatitis, and personal response to determine which option is best for you. Some people respond better to semaglutide-based drugs like Ozempic and Wegovy, while others do better with tirzepatide-based medications like Mounjaro and Zepbound. There's also an interesting development on the horizon that could expand options even further. New oral GLP-1 medications are in development and could be added to the Medicare coverage program by mid-2026 pending FDA approval. These pills would offer an alternative to weekly injections, potentially making treatment more convenient for seniors who struggle with self-injection or have vision problems that make handling syringes difficult. The contrast between Medicare and Medicaid coverage under this new program is also important to understand. Medicare beneficiaries who qualify pay the $50 monthly copay, while Medicaid programs will have access to the same $245 pricing for their beneficiaries, though specific copay amounts will vary by state. This creates some interesting scenarios for dual-eligible beneficiaries who have both Medicare and Medicaid coverage. For seniors who don't qualify for the Medicare pilot program, the landscape is more complicated but not hopeless. Current Medicare coverage remains limited to diabetes treatment, meaning Ozempic prescribed for type 2 diabetes might be covered even if the same person wouldn't qualify for weight loss coverage. This creates a somewhat contradictory situation where the medication might help with weight loss as a side effect of diabetes treatment, but Medicare won't pay for it when prescribed primarily for weight management. The financial impact extends beyond just medication costs. Many seniors have been spending hundreds of dollars on alternative weight loss approaches, from expensive diet programs to bariatric surgery consultations. For someone who qualifies for Medicare coverage of GLP-1 medications, the cost-effectiveness compared to these alternatives is remarkable. Bariatric surgery, for example, can cost $15,000 to $25,000 even with Medicare coverage, while a year of Wegovy under the new program would cost $600 in copays. There are also broader health implications that make this coverage particularly valuable for seniors. Obesity in older adults isn't just about appearance or general health. It directly impacts mobility, independence, and quality of life in ways that are especially significant for this age group. A 70-year-old who loses 40 pounds might regain the ability to climb stairs, garden, or travel comfortably. They might be able to reduce other medications, avoid nursing home placement, or maintain independence longer. The cardiovascular benefits are particularly relevant for Medicare-age adults. These medications don't just cause weight loss, they have direct effects on heart health that are independent of weight loss. For seniors with existing cardiovascular disease, this dual benefit of weight loss and cardiovascular protection makes coverage especially valuable from both individual and public health perspectives. Looking at the implementation timeline, there are several key dates seniors need to know. The TrumpRx.gov program launches in January 2026 for uninsured individuals. The Medicare Part D pilot program begins coverage at the same time, making medications available at the $50 copay for eligible beneficiaries. Between now and then, seniors who think they might qualify should be having conversations with their doctors about eligibility and preparing for the application process. The politics surrounding this coverage are worth understanding because they affect the program's long-term sustainability. The dramatic policy reversal between April 2025's rejection of coverage and November 2025's announcement of the deal reflects broader political differences about healthcare costs and government negotiation with pharmaceutical companies. The Trump administration framed this as achieving better results through direct negotiation rather than traditional regulatory approaches. Critics argue that covering only 10% of Medicare beneficiaries creates an arbitrary distinction between those who qualify and those who don't. They point out that someone with a BMI of 34 receives no coverage, while someone with a BMI of 35 gets medications worth over $2,900 per year in value. Supporters counter that pilot programs allow for careful evaluation of outcomes and costs before broader expansion. The pharmaceutical company's perspective on these negotiations is also interesting. By accepting significantly lower prices for Medicare and TrumpRx.gov, they're essentially trading higher per-unit profits for guaranteed volume and reduced marketing costs. Rather than spending billions advertising to consumers who might not be able to afford their medications, They now have government programs that provide predictable demand at known prices. For seniors trying to determine if they might qualify, the BMI calculation is straightforward but often misunderstood. BMI is calculated by dividing weight in pounds by height in inches squared, then multiplying by 703. Online calculators make this easy, but BMI has limitations. Someone with significant muscle mass might have a high BMI without being obese, while someone who has lost muscle mass due to aging might have health risks even at a BMI that appears normal. The comorbidity requirements for lower BMI thresholds also deserve attention. Prediabetes, for example, affects about 1 in 3 American adults over 65, often without obvious symptoms. A simple blood test showing elevated glucose levels might be the key to qualifying for coverage even without severe obesity. Similarly, cardiovascular disease includes conditions like coronary artery disease, heart attack history, stroke, or peripheral artery disease that many seniors have but might not consider relevant to weight loss medication coverage. Advanced kidney disease, another qualifying condition, is particularly common among older adults and often goes undiagnosed until it's quite advanced. Seniors who haven't had recent kidney function tests might discover they qualify for coverage based on conditions they weren't aware they had. This makes the medical evaluation process an important part of determining eligibility, not just a bureaucratic hurdle. The sleep apnea qualification is especially relevant because this condition is dramatically underdiagnosed in older adults. Many seniors who think they just snore heavily or feel tired during the day might actually have obstructive sleep apnea that would qualify them for coverage. Sleep apnea and obesity create a vicious cycle where weight gain worsens sleep apnea, and poor sleep makes weight loss more difficult. Heart failure is another qualifying condition that's often misunderstood. Many people think of heart failure as meaning the heart has stopped working, but it actually refers to the heart's reduced ability to pump effectively. Symptoms like shortness of breath, fatigue, or swelling in the legs might indicate heart failure that would qualify someone for weight loss medication coverage. The uncontrolled hypertension qualification is particularly interesting because it specifically requires that blood pressure not be well managed. This recognizes that obesity-related hypertension often becomes easier to control with weight loss, making the medication potentially valuable even for people whose blood pressure numbers don't look dangerous on paper. Looking ahead to 2026 and beyond, this pilot program represents more than just medication coverage. It's a test case for whether Medicare can effectively cover obesity treatment in a financially sustainable way. The outcomes will likely influence future decisions about expanding coverage, adding new medications, or modifying eligibility requirements. The success metrics for this pilot program will include not just weight loss outcomes, but also effects on other health conditions, healthcare utilization, and overall costs to Medicare. If seniors in the program require fewer hospitalizations, need fewer medications for diabetes or hypertension, or avoid expensive procedures like joint replacements, the program could pay for itself even at the negotiated prices. There's also the question of what happens when the pilot program period ends. While the specific timeline hasn't been announced, pilot programs typically run for several years before decisions about permanent coverage are made. The data collected during this period will be crucial for determining whether coverage becomes a permanent Medicare benefit or remains limited to pilot participants. For pharmaceutical companies, this program creates both opportunities and challenges. While they're accepting lower prices for covered medications, they're also gaining access to a large, stable customer base with predictable payment. This could influence their research and development priorities, potentially leading to more medications designed specifically for older adults or conditions common in the Medicare population. The international implications are also worth considering. The United States has historically paid higher prices for prescription medications than other developed countries, partly because of limited government price negotiation. This direct negotiation approach, if successful, could become a model for other medication classes or other countries' healthcare systems. As we approach the January 2026 launch date, seniors who think they might qualify should start preparing now. This means having conversations with their primary care doctors about eligibility requirements, ensuring their medical records include accurate documentation of qualifying conditions, and understanding their current Medicare Part D coverage to prepare for the addition of these new benefits. The broader impact of this coverage extends beyond individual health outcomes to family dynamics and financial planning. Many seniors have been receiving financial help from adult children to afford these medications, or have been foregoing treatment entirely due to cost. Medicare coverage could free up family resources for other needs or allow seniors to access treatment they've been unable to afford. This historic change in Medicare coverage represents a fundamental shift in how we approach obesity treatment for older adults. For decades, weight gain was often seen as an inevitable part of aging, with limited options beyond diet and exercise recommendations that many seniors found difficult to implement effectively. These medications offer a medical intervention that can provide significant results even when other approaches have failed. The timing of this coverage also coincides with growing recognition of obesity as a disease rather than a lifestyle choice. This medical model approach reduces stigma and creates a framework for insurance coverage that treats obesity like other chronic conditions. For seniors who have struggled with weight for years or decades, having effective medical treatment covered by Medicare validates their health concerns and provides hope for meaningful improvement. As January 2026 approaches, approximately 10% of Medicare beneficiaries will gain access to weight loss medications that could transform their health, independence, and quality of life for just $50 per month. This represents one of the most significant expansions of Medicare benefits in recent history and could serve as a model for addressing other expensive but effective treatments. For eligible seniors, the opportunity to access these life-changing medications at an affordable cost represents not just better health outcomes, but renewed hope for active, independent aging. The success of this pilot program will likely determine whether obesity treatment becomes a permanent part of Medicare coverage, potentially expanding to help even more seniors in the years ahead. For now, those who qualify have an unprecedented opportunity to access cutting-edge medical treatment at a fraction of its previous cost, marking a new chapter in both Medicare coverage and obesity treatment for America's seniors.